I'm Susanna.
And I'm Samantha.
We're from Camden.
And we're going to graduate Cooper Medical School of Rowan University.
We're extremely proud of Susanna and Samantha. And although they're not the first physicians to come from Camden, New Jersey, they are the first for this new medical school who are actually from the community. We've always wanted our school to be of the community, to be a resource, to be inspirational to young people from the community, and they fulfilled all those dreams.
From the beginning, CMSRU really recognized the importance of having diverse students in our population. They bring a different perspective, they bring different views. So even before we had our first group of medical students here, we actually had our first pipeline program, and that was really to stimulate the diversity of our student population. And that's where we really first met the twins in our college-level Pulse program.
Before we entered the Pulse program, we were terrified to even think of becoming physicians. And once we were here, it gave us perspective that we were capable of doing this.
When they're aligning kind of all the puzzle pieces for you and you sense all the help, I think you become more inspired.
When there was the medical school developing in Camden, for us that was a sign that we were called to come back home and to pursue our studying here. And it was kind of like they were making a medical school for us.
The fact that it happened exactly when we were interested in going to medical school, it kind of seemed like fate.
We recognize that there are a lot of youth that are looking up at us now, and that we are no longer those teenagers looking for mentors and role models. Now the tables have turned and we're in that position.
Service learning has always been something that's very important to CMSRU. It's so important that we made it a part of our curriculum, not just something that's elective, because we feel like the students being out there in the community, that's part of their education.
We decided to do our service learning here at Cooper Medical Arts High School, which is our alma mater high school. We dedicate a lot of our time to Lucy, and it stands for Lifting Up Camden's Youth, and it's a program for at-risk youth here in Camden. It was just very important to speak to as many students in Camden and be able to tell them that, you know, if we did this, then you can do this too.
Susanna and I recently matched into residency. I'm going to be an OBGYN up at Morristown in Atlantic Health. Susanna's going to be a pediatrician at the Goree Ebbs Children's Hospital, also in Morristown.
We just owe this all to our parents. It's important for us to recognize how hard they worked and that they didn't have any of these opportunities that we've had. Ultimately, our goal has always been to come back and serve the underserved. The urban population is where we belong, and I'm thinking about coming back to a place like Camden, if not Camden itself.
CMSRU is special in the sense that we have, as part of our curriculum, a program where we actually reach out to the people of Camden to give back to their community. So Street Medicine is a program that we started in an effort to reach out to the homeless populations of Camden and provide basic services to them, whether it be healthcare, whether it be access to social services, or just someone to listen to, someone to talk to, someone to treat them like a human being. So we bring socks, we bring waters, we bring little bits of food, ways that we can connect with them and show them that we really care about what their basic needs are, and then have them open up so that they can talk to us about what their medical needs are or what other needs they have.
So one of the locations that we go to, there are a few people there that we've seen for at least 4 years. So we're gonna go check up on them today. If we see someone who has an issue that we can handle on the spot, we'll do that. We'll clean wounds, and if there's something more emergent, we tell people to go to the hospital. In worst case scenario, we'll call an ambulance. We want people to get to their appointments. And so every appointment that we've made so far for a patient, we have picked them up and we have taken them there and we have waited. And those are some of the best experiences that I've had. it makes them feel more comfortable because this is new to them. We have patients who haven't gotten medical care for 20 years. And so it definitely helps for them to have a friendly face there with them, and we'll sit and explain things to them. I think it's really helpful for them to understand what's going on with their own body. You just learn so much about the complexity of healthcare, especially in a setting with so many issues like addiction and poverty and, all those kinds of things.
Been homeless I am for going on 9 years. I've been through it all. You're helping people. You've helped a lot of people out here who wouldn't go to the hospital. Them coming out actually helped a lot of people who were sick. They sat there, and people who had like little problems, they came out and fixed them.
The homeless communities in not just Camden, but around the world are incredibly overlooked, ignored. But sitting and talking to somebody living on the streets, trying to hear their story, treating them like they're a human being, I think goes a really long way towards their mental health, towards their trust in people in general and the trust in the community.
It's very important to our school and to our programming that we not just be placed in the community, but be of the community as well.
We would not be successful as a medical school if we don't have an impact in this community.
From the beginning, Cooper Medical School of Rowan University set out to serve as a valuable resource for Camden and be a part of the community in which it resides.
Service learning is really important to CMSRU. It's so important that we felt that it needed to be a part of the curriculum, not something that was just elective.
It stays with you, like you think about the people that you helped here, and that's true whether you're helping at a school or whether you're in the student clinic or whether you're growing food in a garden, that what we've done here is really more impactful to the community and longer lasting.
The ambulatory clerkship is a program that lets us as medical students be the primary care physicians for real patients. And it also helps the community because it's a free clinic for people who don't have insurance.
Voice is a group to help the homeless veterans as well as educate our peers about military affairs and veterans affairs.
So Street Medicine is a program that we started in an effort to reach out to the homeless populations of Camden and provide basic services to them, whether it be healthcare, whether it be access to social services, or just someone to listen to, someone to talk to, someone to treat them like a human being.
Our community engagement focus differentiates CMSRU from other medical schools. By making service learning part of the curriculum, we're not only giving back to the city in which we reside, but we're also instilling an ethos of service to a new generation of physicians who will take that commitment to service with them and spread it around the country and the world.
So the community garden is really great. We work with Ms. Sheila Roberts, who is this wonderful woman who is a community leader and has taken this plot of land in the Landing Square community and divided it up into little mini plots and invites members of the community to come in and plant their own vegetables so that anyone who wants to really has the opportunity to plant their own crops and then come in, help weed and water them, and then once they've grown up, get fresh fruit and vegetables. Because one of the big problems in Camden is that there aren't any real grocery stores here, so that when people want to have access to fresh fruit and fresh produce, they don't really have that. And so the community garden is really great because it's right there for them.
Voice is a group to give back to the Camden community and help the homeless veterans, as well as educate our peers about military affairs and veterans affairs.
Veterans are a very unique patient coming from a healthcare standpoint. As veterans being service-related, there are a lot more service-related injuries or exposures that most civilians aren't afflicted with.
Every other Monday, we go to the Veterans Shelter in Camden called Home for the Brave, and we take turns providing health literacy classes on a myriad of topics that sometimes we choose or sometimes the residents of the shelter ask us to present on because they're curious about.
We take blood pressure checks, we do blood sugar checks, and we also do oxygen checks for the residents. It's very fulfilling to help other veterans.
Because not only are you helping other people, but it's also helping you feel like you haven't lost all connections with your former life.
It's kind of giving back. You know, we're taught in the military to take care of our own, and being able to help our fellow veterans, especially those in need, is very rewarding and fulfilling.